and welcome to this edition of Northwest Newsweek. The first COVID-19 related death in the region was announced this week by the Thunder Bay District Health Unit. A man in his 50s with underlying health conditions passed away Thursday night at the Thunder Bay Regional Hospital due to complications from the virus. COVID-19 Incident Manager Dr. Stuart Kennedy spoke about the tragic death on Friday.
Today at Thunder Regional Hospital in the community is a very sad day. We've experienced our first loss, a life lost, a good life lost due to COVID-19.
Medical Officer of Health Dr. Janet DeMille was not available for an interview, but she's expressing her condolences to the family and friends of the individual. And health officials say this somber event reinforces the seriousness of the COVID crisis. The man was hospitalized at the regional for nearly 2 weeks, and Kennedy says he fought very strongly.
Sometimes this COVID-19 is just overwhelming from a disease perspective. It just takes over the body, takes over the vital signs, the organs, and there's only so much our medical staff, our nursing staff can do to keep this virus from the ultimate course of death.
This is the first COVID-related death in northwestern Ontario. 2 new cases were reported in the Thunder Bay District Friday, bringing the total to 62. A man in his 20s and a woman in her 50s were both exposed through close contact and are currently self-isolating. An outbreak of COVID-19 has struck the Gull Bay First Nation. The community 2 hours north of Thunder Bay now has 6 confirmed cases, with just 11 people being tested so far. Gull Bay leadership says help is on the way in the form of a testing center, but it won't be in the community until the middle of next week. Corey Nordstrom has more.
We have 6 positive cases now in Gull Bay. 2 of those cases, they are hospitalized, and we also have 2 young children that have tested positive in Gull Bay.
Gull Bay Chief Wilfred King says those 6 cases make his community of 300 people the fastest growing caseload of any First Nation. There is help on the way, however. The province will provide and staff an all-in-one triage, testing center and field hospital that should be up in the community by next Wednesday.
A blue tent-like trailer that would be brought in, and that would have confined space and that sort of thing, and an air chamber that's negative and that sort of thing. So we want to make sure that when we do the testing that people don't cross-contaminate each other and cross-contaminate our health center when people go there for other medical reasons.
King says it's frustrating that it will take that long to get assistance, as there is a significant amount of red tape in order to get help from the 2 higher levels of government. Gull Bay residents have been informed by leadership of the dangers of the virus and to follow orders from health officials on the matter. One of the confirmed cases is the elderly owner of the First Nations Lone convenience store, meaning residents are forced to travel off reserve for food and supplies, and leaders can't lock down the community.
Also, we do have services coming in from Thunder Bay, goods and services that there's just no way we could keep those people out of the community.
Chief King is upset that the nearby Lac des Îles mine was deemed an essential service and that the mine continued to operate after the first positive case emerged from their workers. The mine eventually ceased operations, and the number of confirmed cases linked to LDI is now at 20, including the region's first COVID-related death.
Would you say that it was irresponsible of them to not shut down on their own?
Absolutely. I think that they knew the significance of this threat, and for them to remain open, to me is doesn't bode well with the community leadership.
King says about 20 of their community members had regular access to the mine. Corey Nordstrom, TBT News.
The acting medical officer of health for the Northwestern Health Unit says most of its cases of COVID-19 have been resolved as of Friday. Dr. Ian Gemmell says so far, out of the 16 total reported cases in the region, 15 have been resolved. As was reported in previous weeks, the town of Atikokan quickly jumped to 4 cases total, all of which could be attributed to the outbreak at the Lac des Îles mine. This prompted the NWHU to put out a call on social media for mine workers living in the Northwest region to contact them. Gemmell says 36 people responded to the request, and all have been very cooperative.
When we speak to them, we give them instructions about quarantine and so on. We don't have any additional cases out of it. It's only the 4. all of whom are in Atikokan, and some of whom are already out of isolation, as I mentioned before. If there are people that have gone through the process with Public Health Ontario, who's taken this responsibility, we've been assured by Public Health Ontario that if they have had any difficulty finding or any difficulty in terms of getting cooperation from individuals, that they would let us know, and we have not had any notifications of that kind.
The aunt of a young woman who went missing in Nipigon is speaking out about her disappearance and setting the record straight on the speculation that's run rampant both in the community and on social media. 26-year-old Alyssa Turnbull from Gillies Township was last seen in Nipigon on March 23rd. She was reported missing on April 14th, and OPP announced her disappearance 2 days later. Last weekend, numerous police units descended on the small community, including a police helicopter and a dive team. So far, OPP have been very tight-lipped about the investigation, but Turnbull's aunt, Cindy Otway, says police have told the family that they have not found her body. Police did recover 3 garbage bags containing Turnbull's belongings. Otway insists the other rumors circulating online are false. She says her niece struggled with drug addiction, and the family knew something was wrong when she failed to return messages from her siblings. With the massive police presence that's been brought into Nipigon, Otway says the family is hoping for answers, but she admits they're preparing for the worst. One woman from the Red Lake District is dead following a motor vehicle collision near Madsen. Officers with the Red Lake OPP received a call to the accident and discovered the vehicle had left the roadway on Mine Street and was on a frozen body of water where they located a deceased female. No further details have been released, and the identity of the deceased is being withheld until notification of family. The cause of the collision does remain under investigation. There are a few new details in the aftermath of last week's shocking resignation of Ignace Mayor Donald Cunningham. On April 16th, it was announced the first-term mayor had suddenly resigned to take a stand against a group of vocal Ignace citizens who have continually victimized town staff, both within the community and on social media. TBT News has also learned the town's CAO, Chief Building Official, Economic Development Manager, and Economic Development Project Coordinator have also resigned their positions in recent weeks. On April 20th, Deputy Mayor Debbie Hart declared an emergency in the community due to COVID-19.
The second reason we stated was operational. Now, this does not mean that we've lost control. It just provides us an opportunity to highlight any action that's being taken under our emergency response plan, and also hope and help with some of the staffing crisis that we're currently undergoing. My third reason for declaring was the legal reasons. And just simply by stating legal, it protects us and any volunteers who may be able to assist us in connection with the emergency.
Hart says council will now have to declare the mayor's seat vacant and decide how to fill that role. However, she did not say if or when an interim CAO would be appointed. Interview requests to Cunningham and outgoing CAO Marshallina Reeder were turned down. Members of the group of vocal citizens had previously agreed to speak to the issue, but have since decided otherwise. COVID-19 has had an impact on several scheduled projects and events, as well as deadly consequences for the most vulnerable populations. Fortunately, at this time, the hospital in Greenstone has been relatively safe. When the pandemic was first announced, the hospital was, and still is, in the midst of a multi-million-dollar expansion. It is also the site of the district's long-term care facility. Adam Riley has the details.
When it was first announced in October that the province would be providing $17.8 million to expand the emergency department of the nearly 60-year-old Geraldton District Hospital, officials with the hospital had no idea they would also be battling a global health crisis during construction 6 months later. At first, hospital chief executive officer Lucy Bonanno was concerned that construction could be in jeopardy.
I thought, oh no, pandemic, we're going to close down construction. But then when the province came out, the premier came out with the essential and non-essential. And if you looked at it, when it came to construction projects, any hospital project that has started already and has to do with being an addition, they are considered essential.
Bonanno adds work is progressing along well despite COVID-19, and thankfully a bulk of the ongoing work is outside and doesn't require workers to come inside the facility. What will become of the current emergency department once the new one is built is still under discussion, but Bonanno has hopes and ideas, including turning it into an ambulatory care area.
And they'll have everything from their dietitian appointments to their social worker appointments to their even if they've come, say, to have their blood drawn or their x-ray done, this is where they'll register. But so nobody comes, we don't have all that hoarding coming through the emerge.
The hospital also has a long-term care facility attached to it, a healthcare service where the virus has claimed close to 500 lives in southern Ontario. Bonanno says so far so good, and PPE supplies for both the hospital and the long-term care facility are sufficient.
And we are taking precautions regardless with our residents because we haven't had any outbreaks, but still for droplets we do. So some masks are being used, some of our equipment is being used, but we're able thus far to keep up with the demand.
Like many other hospitals in the region, Geraldton District has a limited supply of ventilators. And Bonanno says should patients require advanced respiratory care, they will be transported to Thunder Bay Regional's COVID care unit via Orange or Land Ambulance Services. Adam Riley, TBT News.
Hospitals across the Northwest are doing everything they can to prepare for COVID-19. In Kenora, the Lake of the Woods District Hospital has pulled out all the stops to expand itself should the hospital become overrun with patients who become infected with the virus. Corey Nordstrom explains.
Hospital officials in Kenora are feeling confident as they enter the first week with COVID-19 officially in the community. The first case was announced earlier this month, and as of Friday, there are only 2 confirmed cases. Lake of the Woods District Hospital CEO Ray Reset says they have improved capacity at their facility for potential critical care patients.
We've been able to create more intensive care unit beds on 2 floors so that we've almost tripled our capacity for that, because we know many of the patients who become quite sick, they have respiratory problems. So we know we're going to have to support more patients who require that level of service.
Reset adds several agreements are in place to transfer some patients to a local care home, and some staff are being retrained to allow the hospital to increase its service levels. There has been an unprecedented level of cooperation and collaboration between various service providers, which has allowed for some specialized projects, such as the renovation to the Kuwaitan Arena, creating a 30 to 40 bed isolation unit.
It's quite amazing. I find that working on COVID-19 is a way of unifying everybody. And everybody has a role. Even if you're not a healthcare worker, you can play a role by protecting yourself and being socially responsible. And then that's less people that we need to worry about getting sick.
Should things begin to spiral out of control and the hospital becomes inundated with patients, contingency plans are already in motion, according to Kenora Mayor Dan Raynard.
7 gens has been identified as where the field hospital will go if we ever get to that point. So by flattening the curve in our area, it's really allowed for preparations to come into play.
Raynard is still hopeful that residents of nearby Manitoba will avoid coming out to their Kenora area properties to keep the potential strain on medical resources low. Corey Nordstrom, TBT News.
When we come back, officials with Sioux Lookout's Menoyawan Health Center explain how they're keeping operations smooth during the pandemic.
We want them to know that we're here and they absolutely will have the care that they need.
Every hospital faces its own unique set of challenges. Kenora's is one of the oldest, Greenstone's is under construction, and Sioux Lookouts is a primary care center for many of the fly-in far north communities. As Adam Riley reports, COVID-19 has forced administrators at Menoyawan Health Center to adjust many strategies on how to provide the best care during the pandemic while also preventing the spread of the virus.
Sioux Lookout is often referred to as the hub of the North, and it's that hub aspect that has the Menoyawan Health Center remaining vigilant during these COVID-19 times, not just for locals, but also for residents of the far north who turn to the hospital for their medical needs. Chief Administrative Officer Heather Lee is praising all the far north communities for the precautions they have taken and wants to reassure them that no matter what, they will be there to help.
We continue to see people who need to come out for medical care, and we want them to know that we're here and they absolutely will have the care that they need. I know that within their communities, there's been a lot of work done with our partner organizations to ensure that care is happening in the community as well.
Much like many other hospitals across the region, capacity at Menoyawan has gone down. Lee says prior to the pandemic, the facility was over capacity for over a year, and now that capacity sits at near 50%, which has provided the hospital with some planning opportunities.
It's a little bit of a different scenario for us. We're taking advantage of that time right now. We are very fortunate to have not seen any cases yet, and so we want to make sure that any planning that we can do during this time is completed while we have the room to do it.
According to Lee, the attached hostel could provide an extra 20 beds should the need arise. She says the hospital has also taken several precautions to protect patients and staff even before the first case was reported in Sioux Lookout in March. Those measures include having non-frontline staff work from home. Lee believes in a post-pandemic world, that model could continue.
For those staff that do not have to be in the hospital to do their job, we've allowed them to be at home to work and kept kind of a skeleton crew, if you will, here. And as we move forward, that's something we're definitely looking at is are there positions that could effectively work from home?
Adam Riley, TBT News.
OPP in Sioux Lookout are investigating a bizarre case of vandalism. The incident occurred between April 18th and 19th on Menoyawan Way to several signs and pieces of hospital infrastructure. The signs were defaced with gray spray-painted biblical warnings. The damage was not significant as workers were out on Tuesday removing the paint with relative ease. Menoyawan Health Center CEO Heather Lee says she has no interest in addressing someone who hides behind a can of paint and instead wants to highlight the bravery of staff at the hospital and other essential frontline workers.
Those are the people that I really want to highlight in this because without them, our nurses, our doctors, even our ministry partners and public health, there's so many to name. But I think without us all working together, we wouldn't be able to overcome COVID-19. But I think we're going to be able to, and that's way more important than somebody with a can of spray paint for me.
Anyone with information about the incident is asked to contact the OPP or Crime Stoppers. For the third time in less than a week, a resident of the Northwest has been charged under the Emergency Measures and Civil Protection Act. OPP have laid charges in Sioux Lookout, Greenstone, and now Kenora against individuals who have failed to comply with the act by gathering in large groups over the maximum mandated of 5 people. Financial penalties for those who defy the act include $750 for failure to comply and $1,000 for obstructing any person performing a duty. Local NDP member Judith Monteith-Farrell is calling on the Ford government to do more for long-term care homes amid the COVID-19 pandemic. After recent outbreaks throughout the province, she says seniors and staff need to be better protected. Michael Mahorovich reports.
Following outbreaks in long-term care homes, mainly in southern Ontario, the Ford government has taken action to further protect the facilities. In northwestern Ontario, long-term care homes have managed well against the virus, but MPP Judith Monteith-Farrell wants more to be done to ensure resident safety.
What we need to be is on top of the situation in our long-term care homes. So we need testing, and there hasn't been sufficient testing. Even the Premier admits that now, and so we need to ensure that people going in, that have to go in there are tested, and we have to ensure that any resident showing symptoms is tested. And I pray that we are not going to see any of that in our region, but I want to make sure. I want to make sure that we protect them.
Some of the changes that she'd like to see include aggressively recruiting staff so that long-term care homes can mandate that more staff be scheduled on each shift. And Monteith Farrell wants salaries for workers immediately increased to a minimum of $22 an hour in order to retain and attract workers. But Monteith Farrell says the issues in long-term care homes started long before the pandemic.
I think that we need to learn something from this time, and what's happened in long-term care homes across the province is shameful, but a situation has been shameful in this province around long-term care and home care for a long time. And we've tried to bring that up, and I think, but now it's a crisis, and we need to ensure that these people are safe.
As for how the Ford government has reacted to the pandemic so far, Monteith Farrell says that she thinks they've done their best, but that they should have been more proactive.
We should have been on top of this a bit sooner, and I think, when we asked, are you ready? We know this is coming. And we were assured that they were ready. And now we know that there wasn't sufficient equipment, there wasn't sufficient testing kits. And so those are lessons learned, because we could see this again.
Michael Mahorovich, TBT News.
Coming up after the break, officials with the Superior Greenstone District School Board explain how they're making online learning possible for students who may not have access to the internet. Students across the province are beginning to settle into the routine of schooling through remote learning. While it's easy for students in many urban areas to tap into a Wi-Fi signal and connect with each other, students in some parts of the region are having difficulty finding access to a reliable internet source. However, Superior Greenstone District School Board Director of Education, Nicole Morden-Cormier, says they've come up with ways to maintain the learning cycle should internet access not be available.
As we continue lengthening this process, this time, the notion of reliable internet becomes even more important. What we have done right now, we have worked with Southland Transportation, our bus company, and they are delivering paper packages each week to families who are unable to access Wi-Fi for a variety of reasons.
Morton Cormier says schools within the district have also opened up their Wi-Fi, allowing students and parents to connect from the parking lot. OPP and Atikokan are investigating what they're referring to an act of mischief. A release issued on April 19th states that several complaints were received of nails being scattered across Main Street 6 days earlier. Police are asking for anyone with information to contact the Provincial Communications Center or Crime Stoppers. And that's all for this edition of Northwest Newsweek. Thanks for watching, and we'll see you next time.